My friend was about welcome to medical science class. As a student of medical science, I wanted to take flavor every branch of science. What kind of things say to that is but that is not that is yes and that is good or that is not. As a Muslim, you the one who teaches about our education last English from sometimes you see the question beside the road fall down, and in that case, you know that you check the pulse. Each pulse regular rhythm and pulse remain normal, no problem. Don't worry about it. Some time ago, I handled that kind of case. Fall down and crowd, people gather there. What happened? I go there and see the patient pass. Patient pass, I see the normal range. Then usually what is the problem history? Then medication already given. No problem. Just take rest and then what is the history taken? Then after then medication taken. Now I take Ya Alif Lam Nam Ha Yellow Shapi Yellow Kapi Yellow Mapi Anar Abdul Momushul Shapi Anar Abdul Momushul Mapi Anar Abdul Momushul Ka Lai Illallah Mohammadur Rasulullah the one and indicator it's about all location last time dismissing. Now my friend was about our medical science class. As a student of medical science, I wanted to take the every branch of medical science. What kind of things say that you got that as a Muslim, Allah is the one and only creator. It's all location last time this messenger. La Illallah Mohammadur Rasulullah. Medical science class, I revise the medical science, try to revise the medical science. Also awareness about medical science. Those are human for them. And for that purpose, in your patient, in your home, you learn already say basic of medical science, vital sign. Pulse rate remain normal or not, breath, respiration, rate remain normal or not, heartbeat, heart sound, you see the heart sound remain normal or not, and bowel movement, gut movement remain normal or not, and urination remain normal or not, intake output water remain normal. By that policy you know that that remain patient remain normal. Then if abnormality found, then go to the doctor and treatment. Go to the doctor and treatment taken from the doctor. Now my friend was about a medical science class. We learn medical science. In case of respiration problem, that is dangerous science. You know that kind of respiration, what is just acting. That kind of symptom is bronchoconstriction and in case of case, what case? Nobody knows. That kind of patient is asthmatic patient or allergic asthma or block the trachea. That is the reason that like that normal respiration occur that what I acting, just see me. Just like that. In that situation, oxygen need and as soon as possible hospitalize the patient and nebulization given. Salbutamol nebulization given is asthmatic patient. Asthmatic patient salbutamol nebulization given correct. Otherwise, patient will be the falling danger situation, maybe die as soon as possible. If oxygen, why? Oxygen is the fuel of each and every cell. Creator said fit that body immunity as per medical science say. In every cell need oxygen and glucose. If glucose level remain normal, what is the problem? Oxygen. Glucose and oxygen ATP. That is the cell fuel, adenosine triphosphate. That cell fuel necessary to every cell, every organ. And that kind of problem, oxygen deficiency of oxygen. If oxygen deficiency remain 1 or 2 minutes, oxygen deficiency remain patient, that is enough to damage the organ. In case of also heart, oxygen necessary. That is the reason in that situation, what is you do? As soon as hospital, even if hospital is not possible, open the mouth and give the oxygen, blow the oxygen. Understand? I think better. Oxygen and blow given to the there is the deficiency of oxygen. Now how you understand the oxygen level? Pulse oximeter. Those are my patient. Remain in thermometer in home. First aid box, thermometer, thermometer, BP machine, blood pressure machine, also pulse oximeter. In pulse oximeter, you the oxygen level reduce the 80%, below the 80%. If below the 80%, go to the hospital as soon as possible. 95, 94, go to the oxygen level even equal more or less 99%. That is normal. Understand? I think better understand. Pulse oximeter, there is the necessary check the pulse. Pulse also ECG show in pulse oximeter. And in those are my patient in home, remain thermometer, BP machine, pulse oximeter, also necessary drug. For example, what is the necessary drug? Paracetamol, acetaminophen, acetaminophen. Then you taken salbutamol, one less amount salbutamol. If asthmatic patient, salbutamol necessary. If that kind of patient known hospital is not available, pulse rate reduce, give the salbutamol. One dose of salbutamol, then cure. If hospital bed is not available, take the one dose of salbutamol. Okay, fine. So acetaminophen, paracetamol, 10 tablet, salbutamol, then NSAID, omeprazole, then NSAID and omeprazole necessary to do pain. Then you keep your home and salbutamol, antibiotic, you given cephalosporin first generation, antiviral, antiprotozoal, antihistamine, 10 tablet, then antifungal, and then steroid, 1 tablet, 1 steroid, 10 steroid. But without permission, you not taken. One what I am necessary, you say the symptom, then when I say, you take the medication from the home. Telemedicine, for example. Okay, fine. Understand? I think better understand. Then you know the bus. That is your egg box email. In case of surgery, biodine, povidone iodine solution, povidone iodine cream, gauze, and gauze spray, chlorhexidine for cleanness of skin, for hygienic gel, and gloves, and if possible suture material, catgut bicryl, proline silk with suture material, if possible remove for surgery necessary. Okay, fine. Then scissor, then if possible scissor, gauze, bus that enough, biodine and povidone. And for prophylaxis antibiotic already you keep your egg box. That is every home that remain. But in case of my home, not remain. My home I take only paracetamol to keep my home. And there is a utilized as a nuclear medicine, paracetamol, acetaminophen. Fine. Egg box is necessary. I have not enough money. That is the reason egg box is not present. Already I said I take equal more or less 300 taka from home. By that 300 taka I utilize as a equal more or less 300 taka. That taka I for my pocket money and I survive or fulfill my basic need. And in case of butter, food is available. Butter, lunch, supper, dinner, and breakfast. Just smoking. Maximum take out 300 my pocket money go to this smoking and cup of tea. Okay, fine. Just like that. Also in my pocket there is a cigarette, you know that. And box, cigarette box, there is a cigarette. I'm addicted. You know that addiction is not good for health. I am a chain smoker. Smoking is bad for health. And chain smoker also, you know that, take a cup of tea. In case of narcotic cases, I also want to take every product of narcotic. What is the body effect? Already research done. I take the ganja and give the lecture of the patient, see the patient, take ganja, what is the narcotic product like ganja, for understand how I cure that kind of patient. Okay, fine. Not only ganja but also other narcotic product for research purpose. Also sometimes occasion and vacation, addiction purpose. Thank you very much my friend supporter. Today is enough from medical science class.